Since the approval of thrombolysis for treatment of acute stroke, different research groups have aimed to expand its indications to allow more patients to securely benefit from its effects. One of the main goals have been to expand the time window. Current recommendations for IVT in the extended time window follow the criteria of pivotal studies like the EXTEND study, for which the evidence of the recommendation is moderate to low. So our study is about a real-life cohort in which we try to see the clinical outcome or describe the clinical outcome of the treatment of IVT in the extended time window with and without thrombectomy. It's an observational multicenter study using a prospective registry of patients with stroke code activation in Catalonia, which is known as the CICAT. And the time window that we use is from January in 2017 until December 2022. The patients that received IVT in the extended time window were 539. We divided basically into groups, those that receive IVT alone and those that receive IVT plus mechanical thrombectomy, which is known as bridge therapy. So the ones that receive only IVT, we compared them with those that receive IVT in the conventional time window. And for this, the clinical outcomes that we use for efficacy were ranking scale at 90 days, 0 to 1, or return to previous ranking scale status. And for security, mortality, or SITCH, which is asymptomatic intracranial thrombectomy. For the patients that receive only IVT in the extended time window, these results were the same as the ones in the conventional time window. So these real-life outcome or results from our cohort are aligned with the recommendations and reinforces the recommendations that has this moderate to low evidence. For the other analysis with the bridge therapy, our results for efficacy were the same in both groups, extended time window and conventional time window, but for security, in the extended time window group, there was a higher percentage of mortality. So maybe for bridge therapy in the extended time window, we need still a little bit more evidence and real life practice.